Question 1. A physician administers 8 mg of zoledronic acid from a 10 mg single-dose vial to a patient in the office. How should the provider report the portion of the drug that was not administered to the patient? A. Bill for the full 10 mg vial without a modifier. B. Report the 2 mg of wasted drug on a separate claim line with modifier JW. C. Do not report the wasted amount as it was not used. D. Append modifier -76 to the drug code to indicate the waste. Answer: B. Report the 2 mg of wasted drug on a separate claim line with modifier JW. This question tests the correct reporting of drug waste from a single-use vial. The key clue is that 2 mg of the drug was not administered from a single-dose vial, which requires specific documentation. Payers like Medicare require providers to bill for the administered amount on one line and the discarded amount on a second line with the JW modifier to be reimbursed for the entire vial. For example, if 8 mg was given, one line would be for 8 units, and the second line would be for 2 units with the JW modifier. Remember, the JW modifier is essential for getting paid for drug amounts that had to be discarded. Question 2. An ambulance crew is dispatched for an emergency call. Upon arrival, the EMTs assess the patient, who then refuses transport to the hospital. Which HCPCS Level II code reports the services rendered? A. A0428 Ambulance Service, Basic Life Support, Non-Emergency Transport, BLS. B. A0427 Ambulance Service, Advanced Life Support, Emergency Transport, Level 1, ALS1 Emergency. C. A0998 Ambulance Response and Treatment, No Transport. D. 99281 Emergency Department Visit, Level 1. Answer: C. A0998 Ambulance Response and Treatment, No Transport. This scenario tests your knowledge of ambulance codes when no patient transport occurs. The keywords "refuses transport" are critical, as they eliminate all codes that describe the transportation of a patient to a facility. Code A0998 is specifically designed for situations where an ambulance responds to a scene and provides an assessment or treatment, but the patient does not end up being transported. Using a code like A0427 or A0428 would be incorrect because they both include the element of transport. Think of A0998 as the code for response without the ride. Question 3. A Medicare patient with chronic respiratory failure requires a hospital bed at home for 3 months. The supplier provides a fixed-height hospital bed. What modifier should be appended to the HCPCS code for the bed to indicate it is being rented? A. NU, New Equipment. B. RR, Rental. C. BP, Beneficiary has been informed of the purchase and rental options. D. KX, Requirements specified in the medical policy have been met. Answer: B. RR, Rental. This question focuses on modifiers for durable medical equipment, DME. The phrase "rented for 3 months" is the direct clue that you need a modifier to specify the nature of the transaction. The RR modifier is used exclusively to indicate that an item of DME is being rented by the patient rather than purchased outright. While other modifiers like KX might also be applicable if specific documentation requirements are met, RR is essential to describe the service as a rental. Always look for keywords like rent, lease, or purchase when coding for DME to select the correct modifier. Question T4. A patient is administered a newly FDA-approved injectable drug that has not yet been assigned a specific J code. How should this drug be reported on a claim? A. Use the J code for the most similar drug available. B. Report J3490, unclassified drugs. C. Do not bill for the drug until a permanent code is assigned. D. Report J9999, not otherwise classified, antineoplastic drugs. Answer B. Report J3490, unclassified drugs. This question tests the procedure for billing unclassified drugs. The key information is that the drug is newly FDA approved and has not yet been assigned a specific J code. In this situation, the correct approach is to use a miscellaneous or unclassified code, and J3490 is designated for drugs that do not have a more specific code. The claim must be submitted with the drug's name, dosage, and National Drug Code (NDC) number for proper processing. Using a code for a similar drug is incorrect, and waiting to bill is not a viable option for providers. Question 5. During an in-office surgical procedure, the physician uses a standard sterile surgical tray containing drapes, gauze, and other basic supplies. Which code reports the provision of this tray? A. 99070. B. A. 4550. C. A. 4216. D. G0463. Answer B. A. 4550. This question assesses the coding for common medical supplies, specifically a surgical tray. The keyword is standard sterile surgical tray, which has a designated HCPCS Level II code. Code A4550 is defined as surgical trays and is used to report the non-routine supplies necessary for an in-office procedure. CPT code 99070 is a more generic supply code that is not accepted by all payers, like Medicare, while A4216 is for sterile saline, and G0463 is for a hospital outpatient clinic visit. When a specific HCPCS code like A4550 exists for a supply, it should always be used over a more generic one. Question 6. A physician performs an arthrocentesis on a patient's right knee. The CPT code for the procedure is 20610. Which HCPCS Level II modifier should be appended to indicate the procedure was performed on the right side of the body? A. -50. B. LT. C. RT. D. R. Answer C. RT. This question tests the application of laterality modifiers, which specify the side of the body. The keyword right knee clearly indicates that a modifier is needed to add this anatomical detail to the CPT code. The RT modifier is the standard HCPCS modifier for right side. While LT would be used for the left side and -50 for bilateral procedures, RT is the only correct choice for a procedure performed exclusively on the right side. Always check the documentation for anatomical specifics like left, right, or bilateral, as these modifiers are crucial for accurate claim processing. Question 7. A durable medical equipment supplier provides a patient with a brand new, standard manual wheelchair. Which modifier must be appended to the wheelchair's HCPCS code to indicate its status? A. RR, rental. B. UE, used equipment. C. MS, 6-month maintenance and servicing fee. D. NU, new equipment. Answer D. NU, new equipment. The concept being tested is the use of modifiers to describe the condition of durable medical equipment, DME. The keyword brand new directly corresponds to the NU modifier, which signifies new equipment. This modifier is essential for payers to understand that the item was purchased new, not rented, RR, or purchased used, UE. For example, when billing for a new wheelchair, e.g., K0001, appending the NU modifier is critical for proper reimbursement. A simple tip is to remember NU for new and RR for rental when dealing with any DME claims. Question 8. An ambulance transports a Medicare patient from their residence to the hospital for a scheduled admission. Which two-letter modifier should be appended to the ambulance service code? A. HH. B. RH. C. HR. D. RR. Answer B. RH. This question is about ambulance origin and destination modifiers. These two-letter modifiers are crucial, with the first letter indicating the origin and the second indicating the destination. In this case, the keywords are from their residence, origin, to the hospital, destination. The code for residence is R and the code for hospital is H, so the correct modifier is RH. Memorizing the single-letter codes, like R for residence, H for hospital, P for physician's office, N for skilled nursing facility, is the key to building these modifiers correctly. Question 9. A provider's documentation specifies a standard wheelchair, but the billing department has the option of using a generic HCPCS code for unspecified mobility device or a more specific code for standard wheelchair, K0001. According to coding guidelines, which code should be selected? A. The generic code, because it covers a broader category. B. Either code is acceptable. C. The more specific code, K0001. D. The code with the higher reimbursement. Answer C. The more specific code, K0001. This question tests the fundamental coding principle of specificity. The guideline is to always report the most specific code available that fully describes the service or supply provided. The keywords standard wheelchair point directly to a specific code, K0001, making the unspecified code incorrect. Even if a generic code seems to fit, if a more detailed code exists that accurately reflects the documentation, you must use it. Think of it like this: you wouldn't describe a cat as just an animal if the word cat was available. Question 10. A commercial insurance plan has authorized acupuncture services for a patient's chronic low back pain. Since Medicare does not nationally cover this service, a CPT code may not be available or payable. Which HCPCS Level II code series would most likely be used by the private payer to process claims for this type of service? A. G codes. B. J codes. C. S codes. D. L codes. Answer C. S codes. This question assesses your knowledge of the different HCPCS code categories and their uses. The keyword clue is that this service is for a commercial insurance plan and is a service not nationally covered by Medicare. The S-code series, S0000, S9999, was established to report drugs, services, and supplies for which no national codes exist but are needed by private payers like Blue Cross/Blue Shield and other commercial insurers. G codes are for temporary Medicare procedures, J codes are for drugs, and L codes are for orthotics/prosthetics. The S codes act as a private payer code set. Question 11. A patient receives an injection of 50 milligrams of a drug. The HCPCS J-code descriptor for this drug is injection, 10 milligrams. How many units of service should be reported on the claim? A. 1. B. 5. C. 10. D. 50. Answer B. 5. This question tests your ability to calculate billing units for drugs. The key is to compare the administered amount, 50 milligrams, to the HCPCS code descriptor, 10 milligrams. To determine the number of units, you divide the total dosage given by the dosage listed in the code's description. In this case, 50 milligrams, administered, divided by 10 milligrams, per code unit, equals 5 units. It is a common mistake to bill 1 unit for the injection or 50 units for the milligrams. Always base the unit calculation on the drug-specific HCPCS code description. Question 12. A patient is prescribed a custom-fabricated ankle-foot orthosis, AFO, to stabilize their ankle after a stroke. Which section of HCPCS Level II would be used to find the code for this device? A. J codes, drugs. B. E codes, durable medical equipment. C. L codes, orthotic and prosthetic procedures, devices. D. A codes, medical and surgical supplies. Answer: C. L codes, orthotic and prosthetic procedures, devices. This question tests your knowledge of the major HCPCS code categories. The key term is orthosis, which is a device used to support or correct a part of the body. The L code section is specifically designated for all orthotic and prosthetic devices, including braces, splints, and artificial limbs. An ankle-foot orthosis, AFO, is a type of brace, so its code must be located in the L0000L4999 range. Knowing the general categories, like L for orthotics and E for durable medical equipment like wheelchairs, is a crucial first step in finding the right code. Question 13. A 70-year-old Medicare beneficiary presents for his scheduled Welcome to Medicare preventive visit. Which HCPCS code should be reported for this specific service? A. 99387. B. G0402. C. G0438. D. S0610. Answer: B. G0402. This question focuses on coding for specific Medicare preventive services, which often use G codes. The keywords are Welcome to Medicare Visit, which is a distinct, one-time service for new Medicare Part B beneficiaries. Code G0402 is defined as the initial preventive physical examination, face-to-face visit, services limited to new beneficiary during the first 12 months of Medicare enrollment. G0438 is for the annual wellness visit. 99387 is a CPT preventive medicine code not used for this Medicare service, and S codes are not used by Medicare. Always use specific G codes for Medicare-only services when they are available. Question 14. A patient is fitted and dispensed a complete pair of standard eyeglasses with single-vision glass lenses. Which HCPCS Level II code series would be used to report the eyeglasses? A. L codes. B. E codes. C. A codes. D. V codes. Answer: D. V codes. This question assesses knowledge of the HCPCS sections, specifically for vision-related hardware. The keywords eyeglasses and single-vision glass lenses point directly to the V code section. V codes, V2020 V2799, are used to report vision hardware, including frames, lenses, contact lenses, and low vision aids. While other sections cover different types of medical equipment, V codes are exclusively for vision supplies. A helpful way to remember is V for vision. Question 15. A patient with a gastrostomy tube requires a calorie-dense enteral formula to meet their nutritional needs at home. The formula does not contain fiber. Which HCPCS Level II code series is used to report the enteral nutrition formula? A. B codes. B. J codes. C. S codes. D. E codes. Answer: A. B codes. This question tests the coding for parenteral and enteral nutrition, PEN. The keyword enteral formula is your clue to look in the B code section of HCPCS. The B codes, B4000 B9999, are used exclusively to report the formulas, supplies, and equipment necessary for enteral and parenteral nutrition. For example, a specific formula like enteral formula, nutritionally complete, calorically dense, would be found in this section, e.g., B4152. Remember before belly or bolus to associate this section with tube feeding supplies. Question 16. A patient is taken to the operating room for a scheduled outpatient surgical procedure at a hospital. Shortly after anesthesia is administered, the procedure is terminated by the physician due to a sudden drop in the patient's blood pressure. How would the hospital facility report this discontinued procedure? A. Append modifier -52, reduced services. B. Append modifier -53, discontinued procedure. C. Append modifier -73, discontinued outpatient hospital/ASC procedure prior to anesthesia. D. Append modifier -74, discontinued outpatient hospital/ASC procedure after anesthesia. Answer: D. Append modifier -74, discontinued outpatient hospital/ASC procedure after anesthesia. This question tests the correct use of procedural modifiers in a facility setting. The critical keywords are hospital facility, terminated, and after anesthesia is administered. Modifier -74 is specifically used by an ambulatory surgery center, ASC, or hospital outpatient department to indicate that a procedure was stopped after the administration of anesthesia. Modifier -73 is used if the procedure is stopped before anesthesia, and modifier -53 is used by physicians, not facilities, to report a discontinued procedure. The timing of the discontinuation, before or after anesthesia, is the key to choosing between -73 and -74. Question 17. A patient who has had a below-the-knee amputation is being fitted for an artificial limb. Which section of the HCPCS Level II codebook would be used to find the code for this device? A. L codes, orthotic and prosthetic procedures, devices. B. E codes, durable medical equipment. C. P codes, pathology and laboratory services. D. A codes, medical and surgical supplies. Answer: A. L codes, orthotic and prosthetic procedures, devices. This question differentiates between orthotics and prosthetics. The keyword is prosthetic, which refers to an artificial device that replaces a missing body part. The L code section of HCPCS is designated for both orthotics, devices that support a weak body part, and prosthetics, devices that replace a body part. A below-the-knee artificial limb would be found in the L5000-L9999 range. Understanding that L codes cover both braces and artificial limbs is essential for correct code selection. Question 18. A patient is prescribed a therapeutic shoe insert that has a specific Medicare Local Coverage Determination (LCD) policy outlining the exact medical conditions for which it is covered. The physician has documented the patient's qualifying condition thoroughly in the medical record. What modifier should be appended to the HCPCS code for the insert to attest that the documentation requirements have been met? A. GA. B. GY. C. KX. D. QW. Answer: C. KX. This question is about using modifiers to communicate medical necessity. The key phrase is that the documentation meets the requirements of a specific policy, which is a direct signal for the KX modifier. The KX modifier, requirements specified in the medical policy have been met, attests that the provider has the specific documentation on file to prove the service is reasonable and necessary according to the payer's rules. This modifier helps prevent an automatic denial for services that have strict coverage criteria. Always think of KX as the I have the proof modifier. Question 19. A patient with type 1 diabetes is prescribed a standard blood glucose monitor for home use. Which HCPCS Level II code series should be used to report this piece of durable medical equipment? A. A codes. B. B codes. C. E codes. D. J codes. Answer: C. E codes. This question tests your knowledge of the different categories of durable medical equipment, DME. The key item is blood glucose monitor, which is a classic example of DME. The E-code section, E0100E8002, is used to report a wide variety of DME, including items like hospital beds, oxygen equipment, and blood glucose monitors, e.g., E0607. Knowing the main categories is key: E codes for durable equipment, A codes for supplies and ambulance, and B codes for nutritional formulas. Question 20. A supplier provides a wheelchair to a Medicare patient that is described by a temporary K code. What is the purpose of the K code series in the HCPCS Level II system? A. To report services for which no CPT code exists. B. To report all new and unclassified durable medical equipment. C. To act as temporary codes for durable medical equipment, prosthetics, orthotics, and supplies, DMEPOs. D. To report injectable drugs administered in a physician's office. Answer: C. To act as temporary codes for durable medical equipment, prosthetics, orthotics, and supplies, DMEPOs. This question assesses understanding of the temporary code categories within HCPCS. The K codes are specifically used as temporary national codes for durable medical equipment, prosthetics, orthotics, and supplies, DMEPOs. These codes are created when a permanent L code or E code is not yet available for a new item, allowing suppliers to bill for it in the interim. For example, a new type of wheelchair might have a K code for a few years before a permanent L code is established. Think of K codes as temporary placeholders for DMEPOs items. Question 21. A patient with metastatic cancer is prescribed capecitabine, an oral chemotherapy drug, to be taken at home. Which HCPCS Level II code series is used to report oral anti-cancer drugs? A. Q codes. B. S codes. C. J9000 J9999. D. J8500 J8999. Answer: D. J8500 J8999. This question tests knowledge of the specific subcategories within the J code section. The keywords are oral chemotherapy drug, which directs you to a very specific range of codes. While the entire J code section covers drugs, the range J8500 J8999 is reserved exclusively for oral anti-cancer drugs. The more commonly known J9000 J9999 range is for chemotherapy drugs administered by other means, such as intravenously. Always pay close attention to the route of administration, e.g., oral, injectable, when selecting a drug code. Question 22. A nurse applies a 6-foot-long elastic bandage to a patient's leg. The HCPCS code for this supply is A6449, elastic bandage, woven, width 4 inches, per yard. How many units of service should be billed? A. 1. B. 2. C. 3. D. 6. Answer: B. 2. This question tests your ability to correctly calculate and convert units of service. The key is to compare the amount used, 6 foot long, with the unit of measure in the code description, per yard. Since there are 3 feet in 1 yard, you must convert the amount used into the billable unit. In this case, 6 feet divided by 3 feet per yard equals 2 yards, so you would report 2 units of service. Always read the code description carefully to see if you need to do a conversion before assigning units. Question 23. During a PET scan, a patient is administered 1 millicurie, MCI, of technetium Tc99M cestamide. Which HCPCS Level II code series would be used to report the radiopharmaceutical agent itself? A. A9500 A9999. B. J9000 J9999. C. G0000 G9999. D. C1713 C9899. Answer: A. A9500 A9999. This question focuses on coding for supplies used in diagnostic imaging. The keyword is radiopharmaceutical agent, which refers to the radioactive drug used in procedures like PET scans and nuclear medicine studies. The A code section A9500 A9999 is specifically designated for these radiopharmaceutical agents and diagnostic contrast materials. While J codes are for drugs, this specific subset of diagnostic agents is located in the A codes. For instance, A9500 is the code for technetium Tc99M sestimib. A good tip is to associate the codes with supplies, including specialized ones like contrast and radiopharmaceuticals. Question 24. A Medicare patient undergoes a screening Pap test. The specimen is processed by an automated system and then reviewed by a cytotechnologist. Which HCPCS Level II code should be used to report this specific type of screening service? A. 88142. B. Q0091. C. P3000. D. G0123. Answer: D. G0123. This question requires knowledge of specific Medicare G codes for preventive screenings. The keywords screening Pap test, automated system, and Medicare patient point directly to a specific G code. G0123 is defined as screening cytopathology, cervical or vaginal, processed and reviewed by an automated system. CPT codes like 88142 describe similar services but are not what Medicare uses for this specific screening protocol. Q0091 is for obtaining the Pap smear sample, and P3000 is for the pathologist's interpretation, making G0123 the correct code for the lab service described. Question 25. A patient in the hospital receives a transfusion of 1 unit of packed red blood cells. How would the blood product itself be reported? A. Use a CPT code for the transfusion administration. B. The blood product is not billed separately from the hospital stay. C. Report a code from the P code series, e.g., P9021. D. Report a J code for the blood. Answer: C. Report a code from the P code series, e.g., P9021. This question tests the coding for pathology-related supplies, specifically blood products. The key item is 1 unit of packed red blood cells, which is a specific blood product. The P code section of HCPCS, P2028 P9615, is used to report pathology and laboratory services, including various types of blood and blood products. Code P9021 is defined as red blood cells, each unit. The CPT code for transfusion describes the physician's work of administering the blood, not the product itself. Remember P4 pathology or packed cells to correctly locate these codes.